recording.
Wonderful. Hello, I am Dr. Christina Madison, also known as the public health pharmacist, and I am so excited to be interviewing the JP Pritzker, governor. Thank you so much for being here
Thank you.
and for talking with me about reproductive health. So, for me, obviously, as a pharmacist, my big focus is access. And so, one of the things that we talk about is, what are some of the policies and legislation that we can, talk about, give more awareness to, that's allowing for better access to reproductive health?
I'm so glad you asked, and there is so much to do across the country, here in Nevada and in Illinois and everywhere. First of all, we need to make sure that contraception is widely available, easy to get, that you don't need a prescription. It has historically been harder for women to get a hold of contraception than it is men, and that's unfair. And we need to make sure that we have equity when it comes to the provision of contraception. Second, as you know, reproductive rights is a broad subject matter, but it's basically health care. And we ought to be treating it like we treat all health care. That is, you and your doctor make decisions on your own. No politicians in between you and your doctor. So that's true when it comes to IVF. Mm-hmm. That's true when it comes to abortion rights. It's true when you talk about the broad swath of reproductive freedom that we know is so important. So in Illinois, where I'm from, we've made a lot of strides. We got rid of our trigger laws long before, in fact, the Dobbs decision, which took away Roe v. Wade. We had a law on the books that said that if Roe v. Wade ever went away, that we would become an anti-choice state. Mm-hmm. So we had to get rid of that law, which we did before Dobbs. Mm-hmm. And then we passed the Reproductive Health Act. And then Dobbs came, and we expanded rights by essentially saying to women all over the country, if you need reproductive health and you don't have the freedom to exercise those rights in your state, come to ours. Those are things that we should be doing nationally. And it's work that we're doing here in Nevada. We're doing it across other states, but it really should be national law. In my opinion, it ought to be a federal constitutional amendment.
Yeah, that's actually the next question I was going to ask you. So what are some of the things that we could do with a Harris Walz administration, in order to really make sure that these rights are not just in Illinois and Nevada, but all across the country?
Well, we can take the model that's been created in pro-choice states and reproductive rights states and have the Congress pass that and a president sign it. Today, we've got a Republican House of Representatives that will never pass any pro-choice legislation. We have a Democratic Senate, but we don't have a Democratic House. And we have a Democratic president. You need to have all three to get all that done. That's why it's so important that people vote in this election. And it's why it's so important that we have a leader of the country who truly believes in and will push reproductive freedom.
Yeah, so, here's the thing. I think a lot of folks think that this is just a woman problem, right? And so I want to know, how do we get more men understanding that this is not just a me problem, but it affects them as well? And, really the fear in these states that now have legislation against abortion care and have, restrictions against being able to go in and get your health care, right? Because it's a right. How do we get more men to understand that they have skin in the game? And it's not just us, it's not just women that this is impacting, but it impacts men as well.
Well, men across the country, just like women across the country, often want to have children and have trouble having children. So having in vitro fertilization, having the ability to get medical help so that you can have a child is hugely important, and it has to be protected. And you know what? Republicans are trying to take those rights away across the country. So so men are paying attention, because whether you're a married man or you're a couple and you want to have children, there are people who are trying to deny you that right. So that's one thing for men to keep in mind. Mm-hmm. The second is that the loved ones around them, my wife, my daughter, are affected by what the Republicans are trying to do, what people are trying to do to take away reproductive rights. So if I want to protect my daughter, whose rights are fewer now than they were for my wife growing up and my mother. For the last 50 years, now my daughter's rights are diminished. So if we're going to do something, let's protect our daughters as men. Mm-hmm. And vote the right way on this issue. And then the final point I'd make is that when you talk about contraception, men and women use contraception. And when you hear that in states like Alabama, they don't care if they take away your right to contraception. In fact, they're saying that they should have the right to decide whether you can use contraception. And they want to deny people the ability. Why? Because they think they're promoting people having children by denying you the right to decide when you will have children. And so, why should men stand up? And I'm a member of an organization called Men for Choice, which is something important for MEN for CHOICE if you want to join. But men who care about personal freedom, men who care about the women in their lives, men who care about their right to decide about when they and their family can have children ought to stand up and do the right thing.
Yeah. And one more thing that I just wanted to talk to you about. So something that's really personal for me is being able to choose the size of my family. And so I have 2 children, and my husband and I unfortunately made the decision not to have a third because of issues around maternal mortality. And as a Black woman living in America, I'm very concerned about the fact that I don't know if I'm going to be able to safely carry and then have a baby because of the way that our healthcare system treats Black women and Black moms. So I'm curious, what are some of the things that you think that we can do to really attack and really go after the issues around our high maternal morbidity and mortality in this country?
Well, it's enormously unfair what's been happening across the country frankly, for as long as anybody can remember, that Black women, I can tell you in Illinois, are 3 times more likely to die giving birth than white women. That's wrong. And there's a reason for it. And it's that healthcare that's being provided, particularly for pregnant women, for Black women, is not nearly as good as the healthcare that's being provided for white women. So you know what? We have to go directly at that problem. And in Illinois, we have passed the Birth Equity Initiative, which is focused on exactly this issue, making sure that we have doulas and midwives that are culturally aware and sensitive, indeed Black midwives and doulas, making sure we have programs to train people to become doulas and midwives, and then opening birth equity centers in places that have never had them before. If you have to travel a long way to have your baby and you're going into an area where, frankly, the healthcare workers don't know your community or know the life that you live or have any cultural experience with it, you're not going to get as good care as you would from people who know your community and know you. So we're changing that in Illinois. It's going to take some time. We're making the investments that are necessary. We've got to build the centers, and we're in the process of doing that. But this is a hugely important issue, and as you talk about it, I know it's very personal for everybody, but it's particularly, from my perspective, there's been a racist history that has led to the situation that we're in today, and we can no longer ignore it. It's wrong. And so we're going to reduce maternal mortality rates across the board in Illinois, but specifically focused on the Black community.
Wonderful. Well, thank you so much for all of the work that you're doing. Just one last question. I know that you're doing some pretty amazing things around pharmacy and pharmacist access. And so if you could talk a little bit about that, just because, my shameless plug as a pharmacist. And I just wanted to know, how are you increasing the ability for pharmacy to be able to do the good work in those communities, independent pharmacies? How are you helping them to be able to thrive in order to be able to provide key services in those communities who may have a medical desert and may not have access to a physician or a nurse practitioner?
So there were already medical deserts, as you know, for many, many years, but it's gotten worse. And it's because independent pharmacies have been put out of business. Why? In part because of PBMs. And, the big companies come in and essentially make it impossible for small, rural, ex-urban, suburban, independent pharmacies, many of which I grew up knowing, this is just like the family that lives in your community happens to own the pharmacy that you go to. And they're people that know you. right? I mean, it's like having a doctor that knows you. That's important, right? Going to some complete stranger or worse, some big corporate entity where the person behind the desk doesn't really care about you at all. I mean, they do a good job. They work hard, but the truth is they don't know you. And so they're not on your side trying to figure out how to help you solve your problem. Right. They're just trying to get through the line of people that are there. So we've got to stand up for those independent pharmacies. Now, I think in particular, one of the big challenges we've got to address is these pharmacy benefit managers that stand in between, you and getting the medication that you need. And doctors are frustrated as heck by PBMs too. So your doctor, go talk to your doctor about this too. If if you're a little unclear about why this is happening, your doctor has seen this happen to them and their patients for many, many years. So I'm pleased that I've seen President Biden, Vice President Harris, and others stand up and say, this has got to change. And we're doing it in Illinois, but I know that it's happening all across the country. People are waking up and recognizing change has got to come. So I'm excited about that. We're standing up for small businesses when we do it. We're standing up for, our neighborhood pharmacy. We're standing up for the people that we know that live in our communities. And so I'm pleased at the direction we're going to go, but we have a long way to go.
Yes. So as the most accessible healthcare professional, right? Pharmacists, we know you, we want to help you. And I'm so excited that you're pushing these policies forward. And I just can't wait to see what happens with a Harris-Walz administration and having you as an advocate and ally on their side. I know that we're going to make healthcare better in this country.
Yes, we are. Yes, we can.
Yes. Thank you so much for your time.